call another reversal in the guidance for masking in the fight against COVID-19.
So amid rising infection numbers, especially with the Delta variant becoming the dominant strain, the Centers for Disease Control and Prevention is now saying vaccinated and unvaccinated people should wear masks indoors under certain situations.
Joining us this morning to explain, the CDC Director, Dr. Rochelle Walensky. Dr. Walensky, nice to have you on Good Day New York. Thank you so much.
Good morning. Thanks for having me.
So, of course, those of us who are vaccinated are frustrated. We're like, why is the CDC changing its mask mandate now? Why must we wear masks indoors? I don't think you've kind of explained what you know and why you're changing your stance on this.
Thank you for the opportunity to explain. So what we knew about the Alpha variant was that if you were vaccinated, you were protected against severe disease and death, which is great. But with the Alpha variant, you were also protected against giving disease to somebody else. You could no longer transmit, even if you were one of those rare breakthrough infections. So now we have the majority of the country with Delta variant. Over 80% of our cases are now the Delta variant. And what we've seen in the science now is great news that the Delta variant it can still be neutralized by our vaccines, that if you are vaccinated, you are still protected from severe disease and death. But here's the new science we saw in the last several days, corroborated by several different outbreak investigations. And that is, if you are vaccinated and you happen to be one of those rare breakthrough infections, you in fact can pass disease to others. You can pass disease to others in your home, in your household, people who are unvaccinated, people who are immunosuppressed. We thought it was really critically important for people to understand, even if vaccinated, while protected against disease, they may still be transmitting to other people.
So, Dr. Walensky, I understand that the CDC is not tracking the vaccinated people who are breakthrough cases with the Delta variant, only if they're in the hospital. Why isn't the CDC doing that, considering what's happening right now?
I so appreciate that question and the opportunity to set the record straight, because that is simply not true. We have many different mechanisms to review and monitor breakthrough infections. One of them is through passive reporting, where people just report to us what they're seeing out there. We know that that is underreporting. We're not getting all of the breakthrough infections that are out there just simply through that reporting mechanism alone. So instead, what we do, which is much more epidemiologically sound, is we follow different cohorts all over the country, including tens of thousands of people, some of whom are getting a PCR test for COVID every single week. These are cohorts of essential workers, long-term care facilities, healthcare workers, and people who visit urgent care clinics. And what we are seeing in those cohorts is monitoring for breakthrough infections of both the vaccinated and unvaccinated people. And that is a much more epidemiologically sound way to understand how our vaccines are working at a current point in time with the Alpha variant, with the Delta variant, and how they are working over time longitudinally to ensure long-term protection.
But are you concerned about these breakthrough cases? Are there more breakthrough cases than we know about right now with the Delta variant?
So far, our data have not seen that, but we need to understand that if you're in an area that has a huge amount of disease, somewhere, some of these places that have, that are red on the map, that have disease rates of greater than 350 per 100,000 over a 7-day period, huge amounts of disease, even if you're vaccinated and the vaccine's working 90 to 95% of the time, what you're going to see is that if you know 20 vaccinated people, 1 or 2 of them may have a breakthrough infection. So it's not surprising to me that we are seeing breakthrough infections, especially in areas where we have a huge amount of disease circulating.
Which is New York City.
It's one of many on the map, as you saw.
Dr. Walensky, since you guys are tracking the reinfection rates for people that are fully vaccinated, can you give us a percentage number, even if it's just an estimate of how many people are getting reinfected after being vaccinated?
We are watching that carefully. We know that the vaccines are actually working in the ways that they were studied in terms of preventing severe disease and death. There have been published data out of the UK showing that against the Delta variant for symptomatic disease, they're about 88% protective, and we're following those studies. We have not yet seen any difference so far that they are working any different than we anticipated. And I do want to very much highlight that while these breakthrough infections have the potential to transmit disease, that the vast majority of transmission right now is happening among unvaccinated people.
But you are saying that it is very rare.
It is, well, it's 88% protective, so 10%.
Okay, so 10% of the people are getting reinfected. 10 to 12? That's a pretty high number.
10 to 12%. You know, it really depends. It's a percentage. So if you're in an area that doesn't have very much disease, you're unlikely to encounter somebody who has disease, and therefore you won't see very many breakthrough infections. But if you're in areas that are red on the map, people are not wearing masks, you're encountering a lot of people who potentially have disease. The potential for breakthrough infection is 10 to 12%. But I want to say these are mild disease, not severe disease and hospitalization or death, which is exactly what the vaccines were intended to do.
Okay, so you're saying that is the potential. Some of the numbers we've seen is maybe 0.1% of breakthrough cases. So if you're looking at that, I know you don't have a specific percentage, but if you're looking at that, and that's a very low number, and a lot of experts have said that it's still very rare, that number should be looked at. So if you have that very low number and a rare number of people being reinfected that are fully vaccinated, why make them mask up again if that number is still very low? I mean, it just seems that...
Thank you for that, because the number you're quoting is from I believe, from the passive surveillance of people reporting in. We know that those are underreports, and those don't capture all of the breakthrough infections that are out there. We also know that people who are having mild disease after a vaccine may, in fact, not even be getting a test. So we're encouraging everybody who has symptoms, even after being vaccinated, to get tested, and to get tested if you've been exposed to disease, even if you don't have symptoms.
Dr. Walensky, do you foresee us ever going into a lockdown situation again?
Let me just say that the decision to put masks back on vaccinated people, to suggest masks for vaccinated people in these areas of substantial and high transmission weighed heavily. This was not a decision we made lightly, and I know one that America does not welcome. I have to be humble with this virus. It has taken twists and turns in ways that we've seen in the science that are not ways that I wanted or hoped. My job is to follow the science and to give the public the information that they need to stay safe and healthy. I certainly don't see right now a place where we need to do that, but I need to remain humble and open to whatever potential science would come.
So you're keeping the door open, in other words, to a possible lockdown if you don't see things get better. At what point would you enact that again?
Certainly the CDC wouldn't alone be the one to do that, but I am not in a place where I think that would not be welcome news. I am not seeing that we need to do that now. But let me just say that the best path out of this is to get more and more people vaccinated. When you look at that map, all of those areas that are red, 80% of those have the lowest vaccination rates in this country, less than 40% of people vaccinated. The way out of this is to get more people vaccinated to protect themselves and to protect each other. And that is really the message here. Get more people vaccinated, and until you do, wear your face masks. When that happens, we will have very few places that have orange and red, and then everybody will be able to take off their masks.
The UK is now going, I think, door to door with vaccines. Do you foresee, like, suggesting something, encouraging something like that here in our country?
What I think is important is every community is going to be different in terms of how well they receive the vaccine and how much and how they want to receive the vaccine. What's the information that they're going to need in order to want to get vaccinated, and who's the best person to deliver that information. So that's going to be at the community by community level. Certainly, if there was a community that was interested in our help and federal help in getting people vaccinated by going door to door, we would certainly be there to help. But right now, what we're doing is we're asking communities to reach out to us and say, what can we do to be helpful to you? Is it providing technical support? Is it providing information? Is it providing information in multiple languages? What is it that you need for your community in order to encourage and promote vaccination?
All right. Thank you, Centers for Disease Control Director, Dr. Rochelle Walensky. We'll see how this plays out.
Thank you. We appreciate you coming on and, explaining to our audience this latest, suggestion. We appreciate it.
Thank you. Updated science.
Updated science. Okay.
Thanks so much.